virus has highlighted the fundamental inequalities at the heart of our town and cities. Unfortunately, the vulnerable will continue to be worst affected.
When we come back from COVID, we can't just come back the same. We have to come back better and more equitable.
Our cities must lead the way to bridge the inequities and the gaps in society so that everyone can find peace and prosperity and opportunity for a better life.
Hello and welcome to a panel discussion with mayors about what equity means both pre and pandemic in urban settings. My name is Gillian Tett, I'm with the Financial Times, and we've been proudly working with the Pritzker Forum on Global Cities for several years, looking at these crucial questions of equity in cities. Even before the pandemic hit, I used to love holding these discussions because mayors have a really important role to play in the wider political economy right now. Although the internet has brought us together in some ways, what's happening in our local area has become more important than ever, and the pandemic has reinforced that in both good and bad ways. It has exposed existing inequities, it has intensified them, but in some cases, it's also created energy to try and address bigger structural problems. So what we're going to hear about now from four amazing mayors is what that means in practice. What are they doing in their different cities to overcome some of the inequities revealed by COVID? Can they use this disruptive shock to actually address the key issues? Or are we simply going to have more of the same, potentially even worse in the future? The mayors we have come from all over the world. We've got Mayor LaToya Cantrell, who's from New Orleans. We've got Mayor Eric Garcetti from Los Angeles. Mayor Dan Plato from Cape Town, Executive Mayor from Dan Plato from Cape Town. And Mayor Marvin Rees from Bristol, my fellow Brit. So, wide span of cities involved, but probably confronting quite similar challenges in some ways. And I'd like to start with you, Mayor Cantrell from New Orleans, because in many ways you had a dress rehearsal for the pandemic a few years ago with a terrible experience of the hurricane. After that hurricane, you built back better in a very impressive way that really put New Orleans on the map for many people. But I'm curious, how has that prepared you or not prepared you to deal with the challenges of COVID? And what can you tell us about how to build back better, if you like?
Well, thank you again for having me and for the question. Hurricane Katrina and that aftermath absolutely required us to focus on the disparity gaps that existed in this city, health disparities, but the economic and wealth gaps as well. But building back better in that post-Katrina environment, we have more community health clinics in neighborhoods that never existed 15 years ago, which really allowed us in this COVID-19 pandemic to build and really reach out to those stakeholders that had already been planted in communities and talking about health and testing and mobilizing. Meeting people where they are in our communities and neighborhoods was an advantage, I believe, that grew from Hurricane Katrina. And just the focus has been very much on our Black and Brown communities that have been disproportionately impacted. So COVID hit us at a deficit, no doubt about it, but we immediately knew that we had to go into communities where our most vulnerable are and build up those testing sites again so that we can get a handle on the virus and flatten the curve. And we've been able to do that 3 times now.
Have you seen any of the disparities between the Black and Brown communities and the white communities in terms of their susceptibility to COVID-19? or in terms of the vaccine distribution, have you managed to reduce some of those inequities? Because on a national level, the figures are very stark. I'm going to I'll turn to Los Angeles in just a moment about that, but I'd like to ask briefly about New Orleans, whether you've managed to close that gap at all.
Well, we believe definitely that we have, not only with the testing and again going where people are, but also as it relates to the vaccinations. Now, we have lost 770 of our residents to death due to COVID. 558 of them are African American. And so when it came to the vaccination, we had to ensure that, hey, those who are greatly or the most impacted need to be vaccinated first. So we began setting up pilots and planning for mass distribution at the last quarter of 2020 so that we could be prepared again to stand up testing, but vaccinations in areas, again, in neighborhoods that are the most vulnerable. So we're now leading the country in terms of our residents who are vaccinated at 21%. And so we're going to continue to not only do the mass distribution sites, but it's the smaller mobile testing sites that have proven to be most effective and demonstrating that it's people who look like them that are getting the tests, that are getting the vaccines. And that seems to be getting more and more of our people turning out. At the mass distribution site, over 60% have been from our Black and Brown communities. To the city-managed vaccine sites, 50% have been African American. So we're really getting our folks to turn out.
That is truly fascinating because, demonstration effect in terms of trying to actually use social media or convey the message that actually both testing but also vaccination is not a white-only thing. It actually needs to go into all communities. It's critical. I'd like to bring in Mayor Garcetti at this point because you and I spoke, Mayor Garcetti, a few months ago in relation to this. And back then, you expressed your concern that there was this disparity between different communities in terms of the impact of COVID, and were trying to unveil policies to tackle that. Can you tell us what you actually did and whether it worked and how you may or may be rolling this out to impact the vaccine distribution as well?
Absolutely, and great to be with you, Julian, again. Thank you, Mayor Cantrell, my fellow brother mayors, Rees and Plato as well. And let me start by saying we have to be conscious not just of disparities within our cities, but across the globe. And vaccine equity globally is a very important issue, I think, to all of us, as the problems that we have in the United States are good problems to have compared to places that have barely started to vaccinate at all. And I think we all have to be committed to a global solution in all cities. But within Los Angeles, we're very proud of the work that we've done. Certainly when it came to testing, and we saw, for instance, the disparity between Black deaths and Black population. In Los Angeles in the first month, like around the country, about double the number or percentage of deaths in the African American community compared to the represented population. We were able to, after that first month, be one of the only cities in America that has cut deaths in the African American community to under the represented population. And it was done really with, some very clear messaging, truth tellers, trusted partners. And it's the same thing with vaccines now. And I call it the 4 T's. You need to tell the truth. These are safe. For instance, in Black community, you can say that Black woman was one of the people who developed the Pfizer vaccine. That this is, second, trusted messengers and trusted deliverers of the vaccine. Places where people already go and trust the clinicians that are there. Go to the neighborhood clinic. Go to the, set up those mass centers and those mobile clinics that Mayor Cantrell talked about. Dr. Fauci just looked at Los Angeles this week and said it was the best in the country he had seen. We've surged up almost 10 of those, and they're like a mega site on wheels. Third, though, is technology, and you have to meet people where they are. For instance, in the Latino community, and my family came both from Eastern Europe as Jews fleeing Russia and from Mexico during the Mexican Revolution. My city is half Latino, but 60% of the cases have been the Latino community. Just 23% of the vaccines we're reaching the Latino population. And it's not that we as Latinos are not connected, but we're less likely to have the broadband connection, the laptop and desktop. So you have to be really looking at mobile devices, calling people proactively. And what we do is when new appointments open up, we text certain zip codes with emergency notifications so that they can get that information, they can get those appointments as quickly as people living in Beverly Hills or Brentwood or a more wealthy part of town. And the fourth T is transportation. You must help people get, either by coming to them or to the mass vaccination sites, get a ride. So we've got 20,000 rides from Uber that are either free or half off. We've got our metro system helping people get there. And we're developing that so that people, whether it's somebody with a disability in a dedicated lane for folks that are using paratransit or other things, you have to get them there. So we're very proud of what we're doing, but we still, I think in any city in the world and in America, we still have a long way to go.
Right. I'm curious. I mean, just remind us again about those 4 T's that you used. Transport,
truth, trust, technology, transport.
Right. Okay. Well, that's a very good roadmap that I think many local authorities and municipal groups could actually embrace as well. But I'm curious, Mayor Plato, as Mayor Garcetti says, I mean, there is in some ways a case of, you know, America having problems that the rest of the world will almost envy in terms of the degree that vaccinations are being distributed now. How are you tackling this in Cape Town? You know, how did the COVID-19 pandemic hit people? Was there a great disparity between different communities? And how are you trying to overcome that with the vaccination program?
Well, we're working very closely with our provincial government and our national government. They are the key entities dealing with the vaccination rolling out program across South Africa. As you're aware, or should be aware, lots and lots of the vaccines still needs to reach South Africa. We definitely do not have enough. And our government are still talking to some of the foreign entities about that. We just hope that our vaccines will arrive very, very quickly in the country so that we about 500,000 only in the whole of South Africa out of a population of 56 million have been vaccinated so far. And that is definitely not good enough. Our government, unfortunately, needs to do much more about it. But on other fronts, the municipality, City of Cape Town as a metropolitan municipality, likewise the other mayors, are doing its best to assist the vulnerable, to assist the disadvantaged. We have vast tracts of disadvantaged communities across South Africa, also in Cape Town, as you're aware, and to assist them with regard to the socio-economical needs. We avail tens and tens of millions of rands to that rolling out program to make sure that the people, especially the poverty-stricken communities, receive the necessary aids in the form of food aid, in the form of COVID-19 packs aid, and so forth, that they have clean water. People in Koru, you must realize that there's lots and lots of remote areas across South Africa. We need to really do our level best to reach out to the vulnerable and make sure they have clean water every day, at least to wash their hands and that sort of thing. We could get that right. We could get food parcels out to people, relief and that sort of thing. So we succeed in getting all of those done. Our convention center, International Convention Center in Cape Town, we transformed that into a field hospital, quite successful, and to house 800 patients, with the figures dropping with all these assistance, despite vaccinations and etc. The figures of South Africa and Cape Town particularly is coming down at a dramatic rate. We are very, very pleased about that. So it seems to me we are busy flattening the curve and so forth. But and I believe that the manner in which we have dealt with our reaching out aids to the most vulnerable and others out there help a lot in flattening the curve. So it was really a combination of efforts, of a combination of governmental entities assisting, complementing one another. And if that did not happen, we would have sitting with really a kind of a catastrophe countrywide, and also down here in beautiful Cape Town. It did not happen. We are very chuffed about that. Thank you.
But I'm curious, I mean, how do you possibly implement a shelter-in-place policy, say, in in a city where many people are living in very crowded accommodations and don't have the potential to actually stay at home and shelter in place necessarily?
Well, look, we look at all of those issues, and in the city of Cape Town, we appoint a what we call a high-profile dedicated team to deal with all of those issues. People knowing exactly what to do, and decision makers. I think the most important thing for us was not to get into a meeting kind of a stage every day, but the decision makers needed to take action. They needed to make on-the-spot decisions with regard to how to deal with those issues, and it really worked. High-profile decision makers, high-profile people with the necessary know-how help us big time in overcoming those issues. I can say to you right now, even if that did not happen, it would have been all over the world news that we have lost the fight against the COVID-19 pandemic.
Right. Marvin, I'd like to turn to you at this point, Rees, and ask you, as a fellow Brit, I live in New York, but I have watched the UK government policy over the last year. It's been very chopping and changing. It's gone back and forth quite a few times, in sharp contrast to the way that policy has been created in New York, which has been very consistent. So I'm curious, with these confused messages or changeable messages, how have you managed to keep your local community sort of focused on best practice? And given that so much of healthcare policy in the UK is centralised, what role is there for local networks or initiatives?
On that question of governance, you've really put your finger on something that we think is a real challenge, not just for the way we respond to a pandemic, but the way countries are led at the moment anyway, that there are no levers in national capitals that you can just pull and get good outcomes across the city. You need, across the countries, you need to make space for the dynamism, the local innovation, and the word trust has come up a lot. And I think the opportunity to build relationships of trust between institutions and local populations is stronger at the city level and the local level than it is between communities and national organizations. But straight out the traps with COVID, we set up our own communications channels. I did a weekly press brief that we invited voluntary community sector organizations and businesses to. We pulled city leaders together, leaders of the universities, business community, trade unions, and we would all meet once a week to get the accurate information, the latest information from our Director of Public Health. And then we'd already been working on what we call a Bristol One City approach. So we had a citywide framework and a collection of relationships we were able to work with. And so I think we set up our own relationships, talked about the principles of transmission. So not just putting restrictions in place, but making sure people understood that COVID spread person to person through droplets and through shared contact with services. If you understand the principles, then we empower you to make better decisions about how you manage yourself, reduce risk that you pose to yourself and risk that you take into other people's lives. And we really took that kind of citizen empowerment approach in partnership with our local institutions.
Right. Well, that raises a very interesting question, which I'd like to ask all of you, which is that in the aftermath of the pandemic, and let's all hope there will be an aftermath to the pandemic pretty soon, are you expecting in that aftermath for the relationship between cities and the wider national frameworks of governance to change? Do you think the cities will have an enhanced role going forward? And should they have an enhanced role given what they've done? Maybe I can start with you, Mayor Garcetti, and then turn to Mayor Cantrell.
Absolutely, Gillian. I think that, I chair C40, which is about the 100 largest cities in the world. I think all the mayors on this have participated in some of our programming or our member cities. And one of the things we did early on in the pandemic is I hit the bat signal. And when Zoom was still a new thing, the most moving Zoom call I think of my life I've been on was about 45 mayors around the world as this virus started to spread. The mayor of Seoul telling us what testing was about, the mayor of Milan as people were dying in northern Italian hospitals, the mayor of Delhi as he closed down the city, and then a billion people followed in the country 2 days later. And that kind of convening of mayors made it very clear that cities were going to be on the front line of responding to this, that we had the ability to act more quickly, step out of our lane, build things up. Like in Los Angeles, we've tested more people than any other government entity in the United States of America directly, whether that's state, county, city, or national. And that afterwards, we are going to try to speak with a unified voice to our national governments to really demand that cities be listened to as we rebuild, because this isn't just about reacting and responding. It is about rebuilding and, as you heard Mayor Durkin say in the video leading up to this, reimagining the future, going bold with things. And I'm quite satisfied in the United States right now with the new administration that not only are they listening, but they listened for the past year, and that the Biden-Harris administration, together with this Congress, isn't just looking at the health aspects, but is cutting child poverty in half in America, is looking at child care and tax credits to help the very poorest. It's inspiring us to go big and bold on things like a basic income, to look at what we've done with raising our minimum wage or making community college free, to inspire that at the national level. So I do think cities have earned their place at the national table. There's always politics, so it depends on the country. Sometimes national leaders want to kind of swat down local leaders. But I think as long as we stay unified nationally and as we stay unified internationally, the evidence is clear, the brilliance is, and the innovation and the scars from this pandemic have been earned at the local level. So I think we have a right to talk about how national policy should move after the pandemic.
Well, that's fascinating, because I do find it remarkable, as I've done to you, Mayor Cantrell, that one of the things that was very striking about certainly the Anglo-Saxon world was the complete inability or unwillingness to learn lessons from elsewhere in the world in the early stages. A huge amount of hubris at the national level, both in London and in Washington, which caused tragic results. Whereas, as you say, the mayors were talking to each other and swapping ideas about best practices very early on in a way that got very little attention, but was very, very laudable in many ways. I'm curious, Mayor Cantrell, because you have so many lessons to tell other cities even before the pandemic hit about New Orleans' experience. But do you think it's time to recognize the role that cities play more actively and give them more power in terms of developing policy?
Oh, no doubt about it. And Mayor Garcetti alluded to this under his leadership of C40, and I had the opportunity to serve in that capacity as well. So communicating and collaborating with leaders across the world absolutely gave us just the momentum and the support to just push through, and the courage, quite frankly. But also here in the United States of America, through the U.S. Conference of Mayors, I have to go back to that as well. Us seeing how we were suffering on the front line, how our cities were even being cut out of the federal resources that were allocated and, quite frankly, set aside, supposed to be set aside on the front end for local municipalities, but only to see firsthand that your city was doing what was necessary, with resources and the impact to your budget, the deficits that you had to incur just to meet the expenses and the demands to fight and beat back the virus, but at the same time seeing at the state level to where your dollars were diverted. And so here in the state of Louisiana, one example is that 800 million was supposed to go to local municipalities, but the state legislature redirected over 300 million. And the city of New Orleans submitted expenses 132 million, where 129 was approved, but we only received 60 million of those dollars allocated at the state level. So through the U.S. Conference of Mayors, through us working together, we were able to carry that voice to this current administration who listened. And now with this package that was recently approved, well, our local governments are going to be met where we are, and we're respected and appreciated for the work that we have done. So I am excited about what is to come, so that we can get our fair share of not only dealing with the losses, but even the expenditures that we continue, to incur as we move towards recovery.
Well, those are incredibly important points. And I think certainly it's going to be very interesting to see how the new Biden administration does deal with the mayoral system, because I know it's certainly got a different intention. Whether it can actually put that into practice, we'll have to see. But to make sure this isn't too much of an inward-looking American conversation, I'd like to bring in both Mayor Rees and then Mayor Plato. I mean, in the UK, the direction of almost every government reform in recent years has been for more centralisation and less powers towards local municipalities. But do you think it's time to turn the tide and give a lot more power to the local governments? Because frankly, the national government has not covered itself in glory in the last year.
Well, from the City of Cape Town side, let me say that the relationship between the three tiers of governments, national, provincial and local, was pretty good. We had quite often engagements with our national counterparts, and they realize on their own they will never be able to reach out to communities. They realize immediately they need the local sphere. Looking at as I've said earlier, the spread of information, the spread of food aid, relief aid, social packages, what Mayor Erica also stated before, all the other issues needed in communities and that sort of thing. Municipalities across the world is in the same situation, the same boat. It is how you communicate to your public, how do you spread the relief aid, who must get, who not, and that sort of thing is all very, very important issues on a localized level. And I think the collaboration, not to say you step on someone else's toes, but and recognize the people in power, you recognize the mayors in power, you rely on their expertise. I think that's equally important, and so on. But at the end of the day, I'm quite happy with the fact that with our frontline workers, we could at least look at our frontline people. We could see that our frontline people get vaccinated before anyone else and that sort of thing. And the communities respect that. Because I don't need to say much more about frontline people, you know it all. But at the end of the day, I was quite chuffed and happy with the governance issues that crystallized itself out during the pandemic. Yes, there will always be some gaps. It is how you deal with the necessary gaps. But the beauty was from time to time to receive a phone call from a national minister. The national minister is concerned with the pandemic, that sort of thing. And I think that is equally important. So on that level, quite okay. Lastly, not so happy with the fact that we did not receive enough of the vaccine so that we can vaccinate our public, and that sort of that still needs to come. But okay.
Right. What about you, Mayor Rees? Because I mean, obviously there has been a shift in, there's been growing centralisation in the UK in recent years. But I'm curious, do you expect that to change, and how does that play into the equity question? I mean, do you have the power as Mayor Rees to actually help on the equity issue in Bristol?
Well, first off, I just want to say thank you to Mayor Cantrell and Mayor Garcetti for the election result. It gives me some hope for the planet. To be perfectly frank, over the last few years, just I don't know if that's diplomatic, but I was looking on. But anyway, apart from that, yeah, I mean, I think there's some real risks in the UK. There is a tendency to suck power into Westminster and London. I think I certainly, I'm a member of the Core Cities Network, and there's been a growing conversation in the UK about the importance of real places. Not what Professor Robin Hamilton calls placeless power that happens in the capital, but place-based power that has relationships with real people. And we've seen those conversations. Andy Burnham obviously has been on the forefront of that, and obviously there's an ongoing contest with Mayor SADIK-KHAN as well. I think that one of the big threats to that in the UK is actually increasing uncertainty. not just from COVID, but also from Brexit. And I think the more uncertain the future looks to our national government, the more they want to grab hold of power, and the civil servants want to take control because they won't want to leave it to people who aren't necessarily directly accountable to them. So that's going to be a real tension. If that trend comes to dominate, and there isn't some what I would call humility within national leaders, they will snuff out the potential leadership and innovation of cities and places. And can I just say there's two areas in which I think cities can really lead. Now, clearly, it's at the local level, right? What goes on inside city boundaries? How do we decarbonize our energy systems? How do we retrofit our homes, decarbonize our transport systems? That doesn't happen from buttons in national government. It happens at the local place level. That's where we write the plans. But I think what is less appreciated, but Mayor Garcetti's on the front end of, is cities have an international leadership role. And in many ways, we are now interdependent, right? National governments tend to work within borders and boundaries and see themselves as zero-sum self-interest. Cities recognize their interdependence. What happens in Freetown is of immediate concern to me because I have Sierra Leoneans living in Bristol. Right? I've got Jamaican family, Jamaican Americans. What goes on in Atlanta, in Los Angeles? My cousin is one of Mayor Garcetti's citizens. That's of immediate concern to me. And we share populations. And I think in a world in which so many of the challenges we face are pretty much post-national, city politics might be one of the best vehicles we have to engage in post-national politics. What we need is national governments and our international organizations like the UN to catch up with the potential of cities to be a new voice on the global policy stage.
Right. I often think it's ironic that the only international body we have effectively is called the United Nations, that puts all the emphasis on the nation state. But I'm curious, to bring it back to the direction of the overarching conference about equity, any of you got thoughts to share in the last 10 minutes about what you can or will do coming out of COVID, specifically about how to create a more equitable city? How do you hope to use the disruption of COVID to actually address that? I can see you're nodding enthusiastically, Mayor Cantrell. Any thoughts from you about how you really create a more equitable city?
No, well, absolutely. Now, the city of New Orleans is a hospitality city, destination city where it is the #1 economic driver, which this pandemic has crystallized the need to diversify our economy as well as move and pivot our people into higher wage jobs. So definitely focusing on infrastructure and green and blue infrastructure opportunities, pivoting our people in terms of workforce training and development so that we can get off of hospitality being that main industry, but again, in infrastructure and renewable energy platforms and advanced manufacturing. This is just our opportunity to naturally pivot technology, transportation options, and the like. So we're taking advantage of that. We're using our dislocated worker dollar and training more of our people that were formerly employed by hospitality, and now they're into tech sales, and they're like, who knew, that pitching the dessert, or the special would help me in terms of selling technology and earning a wage just, unsurmountable as it relates to what they received pre-COVID. And so we're just trying to be as intentional as possible, again, by meeting our folks where they are, but giving them the training and the tools that they need to pivot into other growth sectors and earn higher wages. And that has to remain a focus for our city.
Right, I'd like to ask each of you that question about how you create a more equitable city coming out of this. But Mayor Plato, from the point of view of Cape Town, any thoughts from the South African context?
Yeah, no, definitely a diverse city, many different cultures, indigenous groupings and that sort of thing. People were coming from extreme different backgrounds, from the past 27 years only in the new dispensation. We still have a long way to go after apartheid, bringing different cultures, people of all walks of life together and that sort of thing, to say to people, we are all just people. We are all just human beings. We need to get out of that closet of looking at each other's color of the skin. We all have our own sets of brain powers we bring to the table. And the moment we begin to recognize that, we are busy building a new nation and building a new South Africa. And that is what Cape Town are trying to do. And I think it will still take us a long way to go, but at least you need to do something. You need to try. If something in that respect is not working, you try something else, but you need to continue to put your shoulder against the wheel to make sure that we create that beautiful city you after all want. People need to be educated. People need to stay in school. It's no use you're looking at other racial groups and to say they have this, they have that, but you sit backwards. You don't want to finish your studies and that sort of thing. So there's a couple of other issues, disadvantaged, poverty-stricken people also need to do, but government needs to provide them with the necessary opportunities, the necessary means and ways of how to get there. And I think our government, our provincial government, our national government, also us as a city on a localized level, we realize that. And that is why we're doing things in a very specific manner to realize our ultimate goals. Thank you.
Right. Mayor Rees, and then I'll turn to Mayor Garcetti at the end. Mayor Rees.
Well, I think the big opportunity that we have now is to realise that equity is not just a kind of a peripheral social justice issue as a nice to have, but is actually central to building resilience. We've seen that, obviously lower income people, more vulnerable, poor quality housing have been disproportionately impacted by COVID. What that vulnerability within our economy done is actually close the economy down. So if we want to be more resilient, we have to, whether we do it because we want to do it or as we have a sole commitment to it or just because we are being strategically minded, is make sure that we're tackling those inequalities. Remembering that with a shock like COVID, the longer the virus is out there, the more opportunity it has to mutate. So there's some very real direct. This is the embodiment of what Desmond Tutu called Ubuntu, isn't it? You know, we can only be until once we all are. In terms of direct policy, I still emphasise the need to build affordable homes for people in balanced communities, mixed tenure communities. Housing, to me, is a pathway to tackling food poverty, fuel poverty. Having mixed tenure communities can help share aspirations, but also making sure that people get better access to good quality schools because they are genuinely mixed, which feeds into challenges of social justice. There's many more things we need to do about digital exclusion and skills development and hunger, but our emphasis in the city is very much on delivering affordable homes in mixed communities.
Right, well, thank you. Well, I must say the point you make about the fact that, humanity is connected through a global chain, and if the weakest link of that chain breaks, it has a nasty habit of affecting all of us, has been shown so clearly in the pandemic, where not even the rich can entirely barricade themselves into citadels where germs can't get to. So whether it's through self-interest or a general sense of conscience, this issue of equity matters enormously. But Mayor Garcetti, what are your thoughts about what a city like Los Angeles can do to really try and tackle inequity afterwards, and what the wider messages might be?
Well, what a joy this has been, by the way, and thank you to Dan and to Marvin and to LaToya and to you, because I always get great ideas listening to my fellow mayors, and this conversation is so critical. I think our residents can't wait to get out, to go to a restaurant, a nightclub, maybe go see a movie. We as policymakers can't wait to unleash a bunch of policies of equity post-pandemic. And I think we're all excited and have that same hunger that our citizens do, but it's around policies that work. And to me, they're really around a fairer economy. They're about more racial justice, and they're about making sure that we have resilient communities. And what COVID has laid out is, for me, COVID isn't some outlier, once in our lifetime thing. If you're poor or a person of color, or you live in the wrong neighborhood, you have a COVID equivalent every single day of economic downturn, of health conditions, and even, yes, of death. Maybe we can't bring the statistics together as dramatically. But they've been out there in a city like mine, a country like mine, and so many parts of the world every single day. That's what inequality is about. And Marvin said it so beautifully. Equity isn't a side issue. It has to be the prism through which we refract everything. In Los Angeles, that means going big and bold, testing a basic income with some of our poorest residents, which is something we're going to do. Trying to make transit free. We're going to try to become the largest transit body in the United States to make transit free for over 80% of our riders. A right to housing, which is the only way we'll end homelessness in cities like mine. And at the national level, working on that with President Biden. Non-armed responses to things like mental health crises that don't require a police officer, that we're going to be funding 24/7 with vans that roll out. A youth development department and employment of young people, especially standing up out of this pandemic. Bold infrastructure investments, helping our small businesses, especially of color, get the technology and the connections to stand back up again after this. LA's Green New Deal, which mirrors many global Green New Deals to really connect a new energy economy and environmental justice with jobs, and even bold things like looking at reparations and a study to see whether we can find a way to finally erase the centuries that have piled up against people of color by bringing resources to communities to transform them. We have to reimagine, not just respond, not just rebuild, but this is the moment to do it. And I couldn't be more excited to do it alongside these mayors and local communities in my city as well.
Well, thank you all very much indeed. And I should say I couldn't be more thrilled to have been moderating this debate because, as I said at the beginning, talking to mayors is always something which is very encouraging, if not a source of optimism in these times. Even before the pandemic hit, I used to enjoy it because it was one of the few flashpoints of debate which was not wildly bipartisan in terms of wildly partisan in terms of getting stuff done in America. But I think in the last year, this point about pragmatic rolling up the sleeves action and international collaboration and a willingness to learn from each other and connect with each other is extremely important because, as Mayor Rees said, we are living in a some ways post-national world where everybody can learn from everybody else, but sadly has sometimes been rather slow to do so. So I hope that anyone watching this will take the messages away, not just about the practical messages to do with equity and how to build it in cities, but also the other message that there is a class of political leaders out there who are fighting to try and implement practical policies and move forward as fast as they can in the aftermath of the pandemic. So thank you all very much indeed for your time. Best of luck in implementing what you're hoping to implement, and look forward to checking back with you in the future to see how it has played out. And in the meantime, for all those watching, we now have a message from Mayor Khan, SADIK-KHAN of London, about what's happening in his global city and how London is or is not planning to rise to the challenges of equity. Thank you.